Just a quick disclosure to share in conjunction with this podcast. Each of us are speaking to our personal experiences and do not consider ourselves experts and cannot offer medical, therapy, financial, or legal advice. We represent a wide range of experience on the autism spectrum and will always honor each perspective that is brought to our discussions. Our experiences, opinions, and perspectives are all unique and different and will be celebrated. Thank you so much for listening and connecting with us. Thank you. Welcome to Navigating Adult Autism. We are a bunch of moms with a lot of perspectives, a lot of opinions, and a lot of experience. I'm Mary, and I am here tonight with Heather, Cynthia, Tara, Dawn, Elizabeth, and Kara. And our guest tonight is Nathan Wood. He is a speech and language pathologist at the Arc of the Ozarks Autism and Neurodevelopmental Center. Did I say that right?
You did.
Neurodevelopment.
It's a mouthful.
It is a mouthful. Okay. So he is our guest tonight, and we're going to talk all things speech and language. And I'm going to hand it over to our fellow podcaster, Heather.
Hi. Okay. This is Heather. So first, a little bit of information. Nathan is Zachary's current speech therapist. So I just wanted to put that on the recording so that we know he's able to talk about any examples or anything with Zachary that, he would like that would kind of illustrate anything we talk about tonight. So, and then I just have a few fun questions for Nathan. And then, like we said, we're just going to let loose and just ask him all sorts of stuff. So the first one, as many times in my experience, and I'm sure in others that are here tonight, it seems like some of the best therapists that we encounter with our kids often have something, they have some sort of connection, they have some sort of passion about, this community, and that kind of helps them, I think, do a better job. So anyway, our first question is, what inspired you to become a speech pathologist, Nathan?
Oh, great question.
Yeah.
So that's a story. And it's one of those situations in life where it seems like the universe is trying to point you in a particular direction, and I just wasn't listening for the longest time.
Yeah.
I wanted to be a business teacher in college, actually, before speech pathology.
Sounds fun.
I almost failed a macroeconomics class my freshman year of college. I got a D. We celebrated the D, and we dropped business as a major forever.
That's great.
But no, the inspiration really comes from my brother. His name is also Zachary. 32, just turned 32 the other day, profoundly autistic. We're 2 years apart in age. So I grew up with him and all of the challenges that come with that everyone at this table is very aware of. And over time, I got to see different methods of communication, and he had alternative forms of communication that worked to varying degrees. He was never really all that interested in using other forms of communication. And when I got to be in my early 20s, I learned so much more through my degree program. I was learning about all these new innovative ways that people who have previously been nonverbal can start communicating more functionally. And I started to get kind of angry. I said, why was this opportunity not here for my brother all these years ago? Where was this? What were the barriers? And so it was kind of frustration that fueled me into it a little bit more. I was seeking to understand why my brother really never got functional communication and what I could do to try to help him, but also help others. And so I found my way into speech pathology. And it felt like exactly where I needed to be. And he is definitely the inspiration behind everything that I do in my career.
Oh,
yeah.
That's great.
And what kind of, I know you're involved in more than just the therapy sessions at the ARC, right?
Yes.
You're now on the diagnostic team as well?
Correct.
Okay.
Oh, wow.
That's exciting.
It is. And we are working very hard we're just trying to do as many evaluations as we can to open doors for services.
Right.
There's such a need for it. We're the only center in Southwest Missouri right now that's doing what we're doing. Otherwise, we have to go to Kansas City, Columbia, St. Louis, and years-long wait lists. And
we're tired of traveling.
Absolutely.
Yeah.
Absolutely.
Yeah.
Right.
So this next question kind of falls into that the possibilities and having the opportunities. So speech therapy typically ends, as we all know, once someone completes high school, just like Zachary, and they lose all those therapies and things that they were used to having, usually all 12 years of being in school. So what benefits and successes have you experienced with your adult clients post high school? Why do you think speech therapy is not readily available through the lifespan?
I think I'll start with that one.
Yes, yeah.
And I think there's probably lots of reasons for that. In this area in particular, there's just not many places that you can go to get adult speech therapy. Right. Where I'm working is just about it. Yeah. And so I think it's lack of providers, but I know even in our field, it's difficult to find individuals that are always interested in this population. Mm-hmm. I work with a lot of speech pathologists in online forums. We communicate. They're working in nursing homes and hospitals and other settings. And, our scope is so broad. We can do lots of different things. And some of them definitely shy away from the autism population because, when you're working with that population, challenging behaviors are coming along with it. Right. And some people are afraid of that. And so I think it can be hard to find the right therapist. And I know not too long ago, I had a parent come to me. Their child had not quite graduated high school yet, but she was already getting the message, once they turn 18, it's as good as it's going to get. And I threw my proverbial soapbox down on the ground and I said, listen, actually what I find is learning does not stop when we are 18 years old. We can always learn new things. Yes. And communication is a skill that we can continue to hone and we can continue to add to. And so that particular individual, we were working on some early communication skills that kind of got missed over the years and forgotten about. And this was somebody that really didn't do turn taking in a playful way. Everything was just grab and go, grab and go, grab and go. And he said, well, now that we have time and we don't have the constraints of school scheduling and all the pressures that come along with that, why don't we just take a step back and just really focus in on what it is that they want to do and what they're interested in and just follow your lead a little bit. Because in schools, it's challenging for them, right? Because they have so many testing deadlines and things that they have to meet, and they have to follow these IEP objectives to a T because we are so afraid we're going to be out of compliance. That's always the big scary word is compliance. And so we focus more on that sometimes than on the individual, even though it's supposed to be individualized. And so
isn't that the truth?
Well, it's so true. It's so true. And I don't think that that's the intent necessarily, but that's just unfortunately what happens. And so a lot of these adults that I've started working with when they first come out of school, we got fresh perspective and less pressure sometimes, and we can really focus. And so this person in particular, we found ways to start, rolling a ball back and forth, which we think of as a really early skill, but that lended itself to other kinds of vocabulary that we could add and pre-generated messages that we didn't have before because we didn't know we had that interest, right? Yeah. And we couldn't figure that out in school because it's so academically rigorous, and that's where our focus is. But when you can take a step back and focus on what they're doing, you learn more about them. Yeah. And then you can open their world up a little bit more. And that's what I've seen personally, just taking a step back from that. It's a great time to keep going and not stop.
Well, I think, Nathan, you just removed the cliff.
Yeah.
Right? That cliff.
It's a cliff.
After school, you just removed it. Oh, appreciate it.
Thanks. Happy to help.
I will say what we were met with, the response we were met with was when I had asked our service provider in the beginning after high school about speech. I was told that there are, because I said, sure, because I didn't know about you guys then, right? So I said, there's got to be somebody that, that works with adults. And they're like, yeah, they work with adults, but they're adults that have had like actual, what's the words they kind of use? Like an event. Mm-hmm. So maybe they had a stroke or they had whatever. And so then they see those patients. Right. So it's about getting them back to where they were. But she said, we don't really know of anybody who works with someone who, like Zachary, would have a lifelong struggle with this. It's not like an emergent event that happened or a traumatic event that happened. And so it was, I just had to kind of keep pushing. And we worked together to figure out what in the world. And you're right. The clinic that you're at is the only place that's doing that, which is, people don't realize because certainly the service provider that I was working with did not realize it either. Now, she was new, but she was very eager to work with me to kind of figure out, is there any place at all? So, yeah, that's wonderful.
Wow.
Yeah. So what advice would you give? Because I'm hoping that there are a lot of parents and, individuals, whatever, listening to this podcast that never knew it was possible for any of this. Because like we say, the disability cliff is very obvious when you graduate from high school. Like, sorry, you're done. There's nothing more for you except an art class here and there.
Well, I was told you need to contact your doctor and see if they can do private pay. I'm like, oh, okay. Yeah.
Which I think there's even certain one. I know that behavioral therapy for us even stopped at 19. Our insurance would not cover it after 19. So I don't know.
Unless a doctor referred, I think.
Yeah, unless there's
that's what I
some
was told. Yeah.
special circumstance. So Nathan, what advice or encouragement would you give families that have adult children right now on the spectrum that would be interested in finding speech services?
And I mean, specifically in our area?
I would say, yeah, you can just talk about what you know. And even if somebody's in Pennsylvania, there's probably the same sort of structure that they would kind of go through and follow to get the services, hopefully.
I would imagine it would be similar, but definitely in our area, I mean, we are happy to help. There are a lot of facilities, again, and I think kind of what you were saying earlier, we're only working with adults if they've had that event, right? Mm-hmm. And so even amongst us, sometimes there are conversations, well, is this therapeutic if this has kind of been the presentation throughout their lifespan thus far? Mm-hmm. And that kind of makes it challenging too, right? Yeah. But I think where we are at the ARC, we have kind of a different understanding and philosophy. It's like I was saying earlier, we believe that learning doesn't stop. And so we have that culture, and we would love to work with families that have adult children and that have the thought that maybe there's a little bit more that we could do. And also, needs change sometimes. So my brother in particular, he had ABA therapy years ago and some speech therapy. And he went through some medication changes that were very, very difficult and resulted in some very challenging behaviors. And when we finally got that stabilized, he regressed. He lost a lot of skills. And so he had to get services as an adult to regain those skills. Okay. Life events happen, traumas happen, right. Family structures change. And so in those moments, our guys in particular, they're going to really struggle. And so know that I think families, it's important to know that there are resources available and you don't have to struggle and you don't have to suffer in silence necessarily. Yeah. So definitely come and find us. We work with doctors. We've got some wonderful doctors in this area that refer adults to us all the time. They're not shy about referring, and they're very specific about what we're looking for. And most of the time we want something functional. We aren't necessarily looking for you to suddenly become conversational where you haven't been for many years, but we want to kind of understand that person's world a little bit more and give them ways to share. And that's usually attainable with time and intention. So don't be afraid to reach out to us and ask for it. Don't feel like there's nowhere to go once you hit that service cliff, because it's just frankly not true. And I'm seeing it every day. So don't get discouraged, I think would be the big one. And I will say too, just from the perspective since high school of Zachary, we have a lot more words than we ever had when he was in school. And I think part of that was it was such an anxiety-filled place for him. Not that he didn't have, great teachers and things like that, but I'm just saying it was loud and probably obnoxiously loud to him in high school. Like, he was a raw nerve at the end of the day. There was no possibility of we were just surviving the school day. There was no extra let's see if we can make some progress. No, we were in survival mode. And that's why we didn't have him stay. He graduated as soon as he was 18 and able, because that wasn't, that environment wasn't fostering progress. So yeah, I think the concept that, like you said, that they're done doing whatever they're going to do by the time they're 18 is, it's just a bunch of crap.
That's right.
So,
it is. Right? And I feel like you make a really good point, and it goes back to what we were talking about earlier about schools and how we can kind of take a step back. It's not just school administration and teachers and the pressures that they feel, but you're right, a lot of our kiddos, when they're in school, they are in survival mode.
Yeah.
And when you're in survival mode, this sounds horrible, but I had an instructor once said, when you find yourself in survival mode and you're in fight or flight, you get very, very strong and very, very stupid. And that's horrible. I always remember it that way. But I mean, it's true though. When you are in fight or flight, you lose those executive functions, and it's hard to imitate and to answer questions and to use your words. It all goes away. And so, I mean, your Zachary in particular, Heather, when he's come to see us, sometimes we've got loud noises in the lobby, but we've always got a quiet place to go to. And he's generally calm and relaxed, and we get so much more from him than what you probably were often able to get at school. And that's challenging.
Absolutely. So now we get to talk about something fun.
Okay.
So can you tell us about the role an AAC device can have for adults on the spectrum, especially for those that are unable to communicate verbally?
Fantastic question. And I do love talking about this. And we've seen this with your Zachary.
Yes.
A lot. So Heather and I were actually talking about this yesterday, that individuals with autism, they often struggle with verbal interactions. And it's almost as though so many individuals I work with, it's this initiation barrier. And I've heard other autistic adults talk about their wall of awful. So when they go to initiate something, it could be, I want to tell you that I really like your shirt. And that wall of awful just goes up. And I cannot pummel my way through that wall. It's just not going to come. Another example is you're trying to talk, but then the word you want to say, it's like you're on the freeway and your exit's closed. And so what an AAC device does, augmentative alternative communication device, it essentially provides detours that you can take by using multisensory pathways. So if you are struggling with your auditory input or output, AAC devices are fantastic because you're touching and you're hearing and you're seeing. So you've got your visual cues, which we know that our guys often do very, very well with those visual cues. And so it can do a few things. It can, when you're feeling dysregulated or you just can't initiate the word that you're trying to say, there's a visual for you. There's your detour. You're going to go around that roadblock. There's your bulldozer. You're going to knock down the wall a little bit or take one brick out so that you can see. Usually removing the first brick or getting around that first hurdle kind of helps to set other things in place. Another great thing that it does, Zachary, when we first started working, he's using a lot of single words, but we know that he scripts all the time.
Right.
And he's one of those intonation guys, right? So if we just say this, say this, say this, he might. We're going to work really hard at it to get him to. If it's from a familiar movie, if it's from a song that we like, we're going to get it a lot easier, a lot faster. AAC kind of has the same effect. So yesterday he was saying, oh gosh, what was he saying? Halloween. He was saying Halloween. And this is why Heather comes back with me, because she's my interpreter sometimes. I say, it's not just Halloween though. What are we thinking? And so she gives me context, right? We were going to go to Spirit of Halloween after therapy today. I said, oh, great. Let's put that into the device in his places category. So as soon as I put that in, he pushed it and he said, Spirit of Halloween. And Heather said, yes, first therapies, then Spirit of Halloween. Therapy, Spirit of Halloween. Spirit of Halloween.
And he never said Spirit of Halloween.
He had never said Spirit of Halloween before. And so it has this wonderful effect of taking one word and then expanding the sentences.
I love that.
It's pretty cool. It's pretty
So
cool.
when you say AAC device, we know what they are, but for our listeners, can you give a visual description of what it looks like?
Sure. So
our listeners don't really know what we're talking about.
Absolutely. So AAC stands for Augmentative and Alternative Communication. And there's a wide variety of AAC available. From no tech, which could be pictures.
It looks like an iPad.
So no tech could be pictures, and then high tech could be a speech generating device like an iPad. So what Zachary specifically uses is just an iPad that you see Walmart, Amazon, an Apple iPad that has programming built into it, and it's a dedicated device.
Key right there.
That is key. That is key, because I think when we met, he had a device, but it was not dedicated.
So he had an iPad all through school, like. In the school system he went to, even when he was young, I think we were the first ones to buy an iPad because we had, heard whatever. But then the teachers didn't really know what to do with it. But we had Proloquo to go on his iPad. In junior high, he had a little bit of success with that, but not for speech, actually, like communicating with people.
Is that a program or
an app? It's an app.
See, I don't know what that is.
It's just an app that you buy, a speech app, basically, a talker app. But what we found, this is what was key, I think, when we met Nathan, is that he said, well, when he talked to us about AAC devices, I was like, we never had met anybody that could actively actually know how to do it. and they'd have to teach us and Zachary, right? Because I'm not like a computer whiz. But he said that no, he needs a dedicated device that he can't get on the internet. He can't look at VeggieTale. It's a talker, and it just talks for him.
Does one job.
And that really has been the key, I think.
Why? Why has it been the key?
Our guys, if they can find anything else on a tablet that's more fun than communication.
Games or movies.
Well, and the thing of it is communication for them is a job, and it's a hard job. And we organize things quite simply. If it's hard, I don't want to do it. And if I've got, in Zachary's case, my VeggieTales or my videos, whatever it may be, that is much more fun. And I can go over there and just do that on my device and just ignore this talker app over here. But when you have a dedicated device, that's all that there is on it. You don't add anything to it. It's got some basic apps and other things that you need for just operational use. But the only true app is the communication app. And
So when you put this in front of him, he knows it's time.
Yes.
It's time to start working.
And he
And we
knows it's
just
time
call it
now.
a talker.
Yep.
That's what I said. Grab your talker, and most of the time he grabs it anyway when we're getting ready to leave the house because he knows, because he's had enough successful like interactions with it that
It's a positive.
it's
positive tool.
positive reinforcement. Like he knows, like I'm able to say more than just Halloween, because Halloween doesn't really tell anyone anything. Honestly, there's no action to that verbal,
And what was the example the other day where he was with staff and he said, walk? Was it walk? And
Yes.
so they took him for a walk, but that's not really what he meant.
No, walk means get out of here.
Yes.
And I know that because I'm his interpreter.
Means walk away.
It means walk away, please leave, is what it means.
Yeah.
Like I need a break. Like
Nathan says that way.
yes,
That way.
Yes.
yeah. Zachary will say door or walk, and I know that that's normally, And so Abby, his DSP for that day, just thought he wanted to go on a walk, and she said he didn't really enjoy the walk, and I thought, well, that's because he didn't want to go on a walk. So I think it's giving him, because one instance that we had, like, so ordering his meals, let's say, okay, so the independence level, and me and Nathan have talked about this before. Do I think speech therapy after 23 years, right? Because he's 23, will he start speaking in sentences and we're all of a sudden gonna? No. I mean, this is we're dealing with reality here, but can we give him tools so that he can say more to other people? And those tools happen to be electronic. And good Lord, let's take advantage of the IT world that we live in. If it will work, let's do it. So can he say chicken tenders? He can. Can he say, I want chicken tenders and fries? No, he can't and won't. He doesn't speak in sentences. So the AAC device, what's great is he knows where the buttons are. Once he learns, and Nathan has walked him through the paths and that kind of thing, he knows now. I can go right to the food and I can order my McDonald's order. I can order my Domino's order. I can order chicken tenders and fries in a restaurant. And he does it independently, where before I'm talking for him.
Oh my God, that's fantastic.
Yeah.
And I think the other thing that's amazing about Zachary and this process so far is that he's found ways to kind of share with you a little bit more what's interesting to him. But, I see him once a week. I'm not with you in the day to day, but he comes in and he's pushing buttons like Mima and Papa.
Yes.
And, flower pictures and pictures in general. And so I still need you to interpret, but I'm able to kind of piece together the things that he's enjoying in his life right now and the things that are important to him.
Yeah.
Well, and that's communication. I mean, he's actually telling you. This
Yeah, like
is
trying
what
to
I
hold a
like.
conversation.
Yeah.
Nathan.
We added pumpkin patch, because you all know we're on the fall craze.
Yes.
We're trying to get to Christmas, everybody.
Yeah.
So he kept saying pumpkin patch, because that's nice, isn't it? And so I went ahead, we added pumpkin patch. I think in the speech session, we added that. And then the next day he was saying, I want to go pumpkin patch. And then he went to the other screens with people and he said, Daddy.
Wow.
Yeah. I mean, it's like,
I'll
pay $1 million for that stuff. I mean,
Right.
because
Yeah.
he's
Wow.
intentionally telling you what action he wants to take, right? I mean, I understand from my perspective as his mom that when he says pumpkin patch, he wants to know the pumpkin patch. But being able to who he wants to go with, and then there's a time button, so we might say pumpkin patch tomorrow or pumpkin patch Friday, or there's just more details that are coming up that he's able to do on his own. He just walks over there and starts punching it out. Like, listen, people,
But he's still learning about what tomorrow is and what Friday is, or is it on there? Or are you teaching him that too?
Yeah. So
or
the thing about the buttons, and I think people don't understand the buttons. So like, the stuff that's in there, it's stuff that some of it is stuff that's already in the app, right? That Nathan knows is already in there, like some basic colors and days and things like that. But when we're coming to more particular things for Zachary specifically, then we're adding the buttons. And then once you can edit the button. Sorry, I'm getting away from my microphone. You can edit the button and put in anything that he kind of wants to, and then he can navigate through those different pages. So the I want chicken fingers, we had to type that in. So he has that button.
Is there a picture with it?
And there's a picture, yeah.
Okay.
Mm-hmm. And it says the word too.
And sorry to interrupt, but Zachary is also, we try to involve him in any programming that we do. So Heather comes back every week, and every week I ask pretty similar questions. What'd you do this week? What came up? Did we have any challenges? Did we have something, gosh, I wish we had this button? Or we even talk through behaviors and we hypothesize what we think that behavior was trying to communicate. And so we will talk with Zach. And I know when we were coming up with the menu item specifically, we're talking to him, when you go to McDonald's, what do you like? McDonald's. And you prompt him a little bit further and he will say, cheeseburger. Say, okay, cheeseburger, we're going to add in cheeseburger. And it's really fun to watch him watch me add icons. When we added Spirit of Halloween yesterday, he was so interested in that. I mean, he is just locked in. Like, I didn't know you could do that. That's amazing. But then I look at Heather sometimes, can I put a pumpkin on here now? Is it too early? What's going to happen if I put the pumpkin on the device? And she says, it's fine. But it's nice kind of involving him, and not every adult that I work with is that involved. But I think it's also important, going back to talking about what can parents expect, I think it's important for them to be part of that. Once we find a device that really works, you've got two different kinds of vocabulary that you're talking about, Heather. So you have your core vocabulary in AAC, which those are words that you need everywhere you go. Those are your basic functional words like help and bathroom, those types of things. And then fringe vocabulary, fringe, that is things that are specific to us. And speech therapy is set up that I might see you once or twice a week, but in a clinical setting, I can't really see what's important to you or what your needs are. And so I am always encouraging parents to come back and talk me through your week a little bit. What do we need and what's not going well? We have conversations about what's not going well and how can we make it easier. And a lot of times it's this button we do need, but it's buried in there. It's too far, and he gets frustrated when he's having to scan 4 pages to find it. Okay, well, let's move it.
Yeah, no, that makes, because a lot of people are like, how are chicken tenders just already in there? Like, no, they're not already in there.
And do you have to? I have a question about that. Like, if you put in a button about chicken tenders, do you have to then go and get chicken tenders? I mean, is that like something you have to positively reinforce right away?
Yeah, I would say, and Nathan may agree or disagree, but I was always taught up, as he was growing up, that if we got a word, you honor the word, or he may not say it again, because he needs to know there's action. Like, me saying this word is making you do this.
It means something.
It means something instead. So, I mean, that's the approach we still take. I may not leave right that second to go to the pumpkin patch. Like, if he's asking me at 9:00 at night, but we put it on his calendar and we say we're going to go to the pumpkin patch
And
tomorrow.
that's why you're not putting in Christmas too quickly. Okay,
Yes.
I got it.
Yes,
We're trying to get to October 7th.
Yes.
Yeah.
Let's try to hold off on that.
We'll have Christmas before Halloween. There's no doubt in my mind, but at least it won't be in July.
I have a question about Zachary. So when he likes, is it the green store or the orange store that he likes?
He likes both.
Okay. So
So we made both.
you did make those. Is it the proper name? Are you going to teach him the proper name?
Yeah,
Is that
so
what we're
now he
working on?
says, so the orange store was Hobby Lobby, and so now he says Wobby Wobby.
Shout out Hobby Lobby.
No, Nathan, I'm sure would like him to say Hobby Lobby, but I do enjoy the Wobby Wobby. I'm not gonna lie. It's super cute. So now he has, it's the green tree and Hobby Lobby are the two that he was, but that's how he was finding
tree.
green. He would say green, 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 green. And finally I figured out it was the green tree or the Dollar Tree. And orange was the same way. So even for me, knowing most of the time kind of what he wants, I didn't understand what green meant, because I remember saying, well, the grass is green, because we were driving. The grass is green. The sign is green. is your favorite color green? Like, I don't know what. And finally he was like pointing because it was in the Walmart. It was in that super center area. And he was just like pointing like, life was going to end if I didn't figure this out. And so finally I figured it out.
So
and
you
we
put
added
it
the
in
button.
the device with the proper name
Yep.
so he learns how to communicate better.
Yes, and
Yes.
that's Heather and I doing detective work and trying to figure these things out. And I think that's the most difficult part of the journey is that there's going to be some bad days where we're just not going to know. But they're also very necessary because eventually we figure it out one way or the other. And then it's also kind of nice because then you see some of those challenging behaviors decrease over time because now we have a much faster way to say, I want Dollar Tree or I want Hobby Lobby. I want to go to Spirit of Halloween. I want my chicken tenders.
Right. Yeah.
It's much faster because we have, like I said earlier, we've created a detour where we can kind of go around where the roadblock is. And, sometimes when we don't have that, you're seeing green, really frustrated because that's the one word I can find that I can associate with the thing I want, but I can't find the rest of it because that wall of awful is up too high. And when I peek through, I can see one thing, but it's not enough.
Right. Yeah. Not enough to tell. Yeah. There's still many times that we don't understand necessarily what, and we're working with emotions. We've added that for the AAC device. So the thought process is that on down the line, hopefully we will have more about how he feels or what hurts or
headache,
things like that. Right.
That's because that's always been one of my fears with my Nathan is like, we are so diligent. We go to the dentist every 3 months and we do all this. And I've talked to his aides. I said, you've got to make sure because if he gets a toothache, is he going to be able to tell me? And then if they were to put do some dental work and his mouth that doesn't close right and everything's off, is he going to be able to tell me? And so, and by the way, I've done the intake work. So both my boys are on Nathan's list. So
I was just going to answer that.
So, but that just, listening to you, and I really love the expanding language. That's incredible, but really giving them this opportunity to really say what's going on inside, possibly.
Yeah.
Right.
Yeah.
And when do you cover that? Is there a certain time you cover emotions or do you introduce everything?
Honestly, it's individualized.
Okay.
I don't have a rhyme or reason necessarily for when I introduce certain vocabulary because if it's a totally new experience for a patient, we might be starting with some things that are very functional, and we might be starting with just 4 pictures in the beginning, just to start making associations. When you push this button, mom and dad go and get this for you. And then depending on how they do with it, it could get more complex. And Zachary's at a point now where we are wanting to try some more complex things because he showed that he can expand his language. And I mean, he has great ownership over the device. And sometimes with some of my adults we're working on, you have to take the device with you. It is yours. You must hold it by the handle. No, by the handle. No, by the handle. Please do not throw it. Those types of things. Right. But he takes ownership over it. And so we felt it was a really good time to try something a little bit more advanced.
Absolutely.
It's still early. We're still working on it. And he's still figuring it out. So I think we have a little ways to go. But we just kind of thought, why not? I have kind of a what the hell attitude in therapy. Heather knows this. I really do. I said, why not? Let's try it. I am open to anything. Let's go for it.
Yeah, because he has had it since when, Heather?
Oh, well, let's think about this.
Let's think about that.
It took like 8 months to get it in with all the paperwork.
It took a long time.
A year? Not yet a year?
No.
I didn't think
he hasn't
so.
had it
Because
for
he's
a
made
year.
good progress.
No, I would say 6 months maybe.
Yeah.
I feel like he got it in the fall, like last November.
That sounds right.
Yeah.
Yeah.
It did take forever to get it, so patience is definitely required.
It is.
Once you fill out the paperwork.
Can you talk
is
about
that?
the process and
I can. So we at the Arc of the Ozarks, we are a Medicaid approved site for augmentative and alternative communication evaluations. There's another mouthful. Yeah. But we have licensed speech language pathologists that do these AAC evaluations. And a lot of times we have clients that have come to us and, we are trying really hard for verbalizations, but we're not getting very far. And so we have trial devices at our facility that we will utilize, and we'll try different programs to just kind of see how they respond. And if it's going really well, we will place internal referrals with one of those therapists to see if they are a candidate for that device or if there's probably something different. But we also will take outside referrals too. We often recommend it at the conclusion of an autism evaluation. And we'll say, we think that this is a really good option for right now because, verbal skills, not saying they can't come, but it could take a little while and we need a way to communicate right now. And this has shown some promise. So the process is to first have an evaluation at our site and to at the completion of that evaluation, they determine, which device or what type of alternative communication is going to be the most appropriate, get submitted to doctors, get submitted to insurance. And then after that, it's a lot of, submitting paperwork and a lot of waiting. And I don't have a good answer about the wait time because you waited quite a while, Heather, but other families don't always wait all that long. And I can't really answer why that is. I've got one family that's just been waiting and waiting and waiting. And then I had another one that only waited a couple of months.
We waited like 7 months, I think.
I was going to say it's just hard to say. I think certain times of year we get more requests. And so that can influence things as well. And just also availability and staffing. And that's a hard question to answer, but don't give up. You will get it if you want it.
Sorry, is it the cost of the iPad or is it the cost of the software?
Well, it's not the same cost as if you go buy an iPad. I can tell you that. So they, through the whole process when we were getting evaluated and stuff, they didn't say this model is this much, right? Because it's all insurance kind of stuff. So yes, like when we finally got it and I saw like what they valued the thing at. Should I say that?
Yeah.
Sure.
Okay. It was like $7,000 and something dollars. So I don't know. I don't know it is an iPad, but it has the speaker. I mean, like I can't say, to the tech, but it was a certain company and obviously that we use that makes this particular device. And so I didn't get the feeling that you could buy something like that just off the street, kind of.
Right? Yeah, that's what I was wondering.
Right? Yeah, I didn't get the feeling that you could, but
and
I could be wrong.
The app that he has is called Touch Chat. And it's an app that you can purchase through the Apple Store. And we have a lot of families that just go on ahead and they do that. And it's not that I'm necessarily opposed to that, but you're kind of going into it blind sometimes when you do order it. And you need very specific programming and you need an understanding because even though you buy Touch Chat, once you open it, there's tons of different vocabulary options. You can have as many as 4 pictures. You can have, 60 pictures or 72 pictures. It can get pretty complex. And each vocabulary is organized a little bit differently. Some are organized simply. Some are organized so that you can be quite conversational. And it just depends on what your needs are because some of those adults that, they've had a traumatic brain injury or they've had a stroke, they had spoken language previously. Mm-hmm. They've lost the ability to speak, but they're still conversational. Mm-hmm. From a cognitive standpoint, they have the ability to do that. And so they need something more advanced. And so what I found is a lot of families that go in and they just buy it, that's fine, but then they don't know what to do next. And it's helpful to kind of have an understanding of what's working really well in therapy or what your evaluator decides. It helps give some guidance. And the other thing too, for, families that are thinking about it and they're thinking about cost and they're saying, ew. One thing that we do at our facility is I'm trying to think of what they're called, but it's basically an estimate. You call us and you tell us, what insurance you're having, what you're thinking. And then they will speak with a couple of different companies to kind of see what you might expect. So that, because as much as possible, we don't want that to be a barrier, but we also don't want you to be surprised with this big, huge bill after you finally get something that you've been waiting for. Mm-hmm. So we try to reduce that barrier as much as possible.
Nice.
Yeah, because we went through Zachary has Medicaid. Yeah. So, so we didn't have to pay $7,000.
They're great about covering it. Medicaid and the DMA waiver can be slow, obviously, but yeah.
I'm glad you kind of went over that because I just wondered, families hearing this, that, I can go get an iPad off the shelf and I can go to the App Store. Mm-hmm. If somebody tries that and they kind of dabble in it, do you think it does any damage or they just don't find success?
I think it's mostly that they just don't find success. There is no study out there that's ever shown that AAC does any damage towards communication. Most of the time it's just, we just didn't really take to it. And there can be lots of reasons for that. And a lot of times it's, did we set up the right reinforcement for it? Did we pair things that are really motivating with it? Did we empower individuals or did we just set it in front of them and hope for the best? That makes a really, really big difference.
Yeah. I think that's part of, so we talked about this yesterday a little bit, but there's a lot of people that think an AAC device is a barrier to language. And so if they even had like a younger child, they'd think, well, I want them to, I really want verbal communication, so I don't want to try an AAC device. What would you say to that kind of thought process?
We hear it all the time, and I get it. It's a very valid concern. And, you know, my sibling, my brother Zachary, he still does not speak. And I mean, I would just move the heavens and the earth if I could get him to do it.
Yeah.
I've gotten to a point where I've accepted that it's probably not on the cards for him. But when, you know, they're 2 and 3 years old and they're still not talking and you really want them to talk, you know, I know that feeling, and my parents know that feeling. That's hard. And so a lot of times, you know, I will suggest that in an evaluation. Like I said earlier, we need a way to communicate now. And we hear that. If I give them this device, aren't they just going to rely on that and never speak?
Yeah.
And what I always say is, I'm honest, and like some kiddos will rely on that and they may never speak, but they still need a way to communicate.
Yeah.
And I said, you know, if we kind of put this on the back burner and we keep trying to push for speech, we're losing a lot of time not giving them a functional way to communicate right now. So we could say no for 3, 4, 5, 6 years, really push verbalizations, but we've lost lots of critical skills. And so then when we finally get to a point of acceptance, you know, we're not getting verbalizations, we've got a lot of catching up to do. We've got a lot of lost time. And so I tell a lot of my families, you know, don't necessarily, I mean, don't want to tell you how to feel, obviously, but I get that you are fearful of them not verbalizing, but I think you need to be more afraid of the time that you will lose. And the skills that you will not get in that time. That's scarier to me. And I talk a lot about different research studies out there. There are more research studies out there that show that use of AAC promotes verbal speech over time than there are those that don't. And again, the ones that are showing that it didn't really do anything with verbal speech, there were other factors. It was never the device that did it. It was we were not consistent enough with it. We lost providers. We lost follow through. Lots of other factors, but it's never the device that causes you to not speak. All the research supports that it could increase your chances of becoming verbal.
And I think Zachary saying "Spirit of Halloween" is a great example of that.
I was just going to say that. Yes, I was just going to say that. Elizabeth, go ahead.
Yeah, that was the same thing I would hear with my oldest daughter, who's in her 30s now, about sign language. And
sign language is another form of AAC. It's no tech, but it is it's any alternative to speaking. So sign language, pictures.
And I remember when she was in her early intervention program, we pushed and pushed because even the professionals we were working with said, no. And she had the least verbal ability in her classroom. By the end of the year, she was speaking, and all the other families are like, what happened? How come she's speaking and our kids are still at the same place? And by the end of that year, the speech worker that we were with, she's like, I'm learning. She said this, you know, being able to see exactly what you're saying, you know, it changed them. And so she was going to work on speech language or sign language with all her students. So that was way back before iPads.
Like a 3-year-old, like, you know, Zachary not being able to talk at 3, and he didn't. I think we had a couple sign language things that we were doing, but like talking about being in survival mode, wouldn't that put a small child, to me, in a survival mode where they're just they're not going to do anything with leaps and bounds until they can get some basic communication, because they're going to have behaviors and frustration and anxiety and all the other stuff because they can't tell anybody anything.
Well, the other wonderful thing about AAC, I just had this happen a couple of days ago. I had a little 3-year-old. He really wanted somebody else's Bluey cup. Wasn't going to happen. Big meltdown in the waiting room. And I felt so bad for families because I've been through this with my own brother. Everybody's looking at you. And the child has completely fallen apart. And it is not a tantrum. It is a meltdown. They're not the same thing. And he's having a big meltdown. I said, come on back. Nice and calm. We go into a room. We usually go to the gym, but I said, come on into the room. We're going to shut the door. We're going to dim the lights. All our lights are dimmable. That's wonderful. And so we do that, but his device is on the table. And I mean, he's knocking into me, knocking chairs over. He's mad. He's screaming. He's crying. And then he goes over his device and he pushes the button. It says love. And his parents just give him a great big hug. And I cried. I mean, they just held him, and he calmed down after about 2 minutes, and he smiling, on his head, ready to go. I said, "You ready to go to the gym, buddy?"
Yeah.
And so they went off to the gym. But they said that was the first time he had done that. But that's what that's for, because not necessarily, I mean, I don't want people to take away, if they're having a meltdown, they will use the device to tell you how they're feeling. It doesn't always happen that way.
Right.
But he's not going to verbalize it. And this is a kiddo who can sometimes verbalize, but it's not going to happen in that moment. But he saw that cue and knew exactly what he needed. When he pushes love, that means I'm getting tight squeezes, I'm getting attention, and this helps my body calm down. And he recognized that need, and he recognized that he had an outlet. And it's a really powerful thing. It's AAC doing what it's supposed to do.
Exactly right.
But if he hadn't had that, because we were hoping for verbalizations that we didn't encourage another way, I don't know how long that meltdown would have continued.
Yeah.
Right. Yeah, good point.
Till exhaustion.
Till exhaustion.
Till exhaustion, yeah. So do you feel like
AAC.
AAC.
Yeah.
I was going to say AAG. I don't know if it's an investment firm. I don't know. Do you wish they would start a lot younger? I mean, because you were talking about wasting time, and like Zachary's 23. Do you wish he had it as a teenager, or do you have like I know it's individual plan, but do you wish like, oh, I wish all high schoolers had it, because by the time...
Everybody has some different opinions about it.
Do you have a particular opinion about it?
As early as possible.
Okay.
Absolutely. I mean, I don't necessarily say let's start with a high-tech $1,000 speech generating device for an 18-month-old or a 2-year-old, but sign language, absolutely. Pictures, absolutely. Let's make picture boards. Let's get them going. There are no prerequisite skills that you have to have for any form of AAC. You do not have to be at a certain cognitive level. You don't have to have, I mean, we take physical skills into account, but I mean, I have worked with individuals that have limited mobility in their arms, but they scan using switches with their head.
Oh, wow.
That's mounted to a wheelchair, and they click, click, click to the right with their head, and they scan. And
Really?
this individual in particular listened auditorily, so he'd scan more, help, play, and then he would wait. And then play would expand into bubble gun, ball, TV, whatever it may be, and he would just scan until he heard what he wanted. And so that's what we say, sometimes there's this idea that you're just too handicapped for something. And I don't buy into that, because there are,
Good for you.
there are lots of things that are available if you individualize it. So very long-winded explanation of saying, no, I don't think that you're necessarily too young. If we're at an age that we're expecting certain communication skills and they're not coming forward, let's throw everything we've got at it as early as we can and try to help those things come along.
Right. That's great. Elizabeth Jordan.
You mentioned motivation. And so we have some, that can maybe say a little bit more, but can you expand a little bit on motivation?
On motivation. We use it a lot. And, we've got some individuals, it is hard to find what it is that is motivating. It is really, really hard. And then you've got some, there's only one thing that really motivates us. And that's kind of where we start. I'm often having conversations with the team that I can't make you like something new necessarily, because you are the person that you are. And so a lot of times and sometimes it's having those difficult conversations, because I've had some families, I wish that they would do more. I wish that they would be interested in more. So I had more ways to motivate them and expand on it. Is that I can't really force that to happen. All I can really do is just present these things and make it as fun as possible. But if I can find just even that one thing that's important to you, you need to be able to talk about it. You need to be able to ask for it. So motivation is definitely key. If you can find even that one thing, you're pairing something that's really hard with something that's really motivating. And so you increase the likelihood, just like ABA, you're just, we overlap so much, speech pathology and ABA, because we're always motivating and trying to reinforce, and we sabotage routines to create opportunities for you to communicate, which I think even that makes Zachary mad sometimes, because I usually do it this way. And then Nathan comes in and creates an opportunity where you have to use the device where you didn't before. But motivation is definitely key in that. If I had something that wasn't motivating him, and it has happened where I think I've brought something out that Zachary's really going to enjoy, and he does not care one bit about it. And so those sessions look very different from when I found something that does work really well. And sometimes that's really hard to find.
Yeah. Did you have a question, Dawn, or no?
Yeah.
Okay.
What's your professional opinion on facilitated communication? Have you ever used a letterboard Spellers, that documentary came out a couple of years
Explain
ago.
what that is.
Well, facilitated communication And I don't remember exactly. I feel like it was something that was really coming into prominence maybe in the early 90s. And essentially, I think well, just to kind of jump right into it, it's an approach that's been discredited by many organizations, the American Psychological Association, my association, American Speech, Language, and Hearing Association, BCBA's groups. There's a lot of groups that have found that there's just not a lot of scientific evidence behind it. What was happening, I think it was born from good intention. So facilitated communication is essentially guiding a person's arms or extremities
to a letterboard
or a keyboard. And what they were finding in most of the cases is that the facilitator moving the limbs was actually doing the typing and not the person.
Yeah, how can you tell, really? I mean,
and it was born, I think, from very good intentions. There are even some components of it that you do find when you're working with adults and training them how to use AAC, which kind of brings in a whole other thing. I'll get to that in a second. But I mean, we use a lot of hand-over-hand supports in the beginning because, especially with our little ones, they sometimes don't even interact with anything physically because their bodies are just moving all the time. We can give you that movement, but we need you to touch this device first. And sometimes I'll try even just a positional prompt and really get down where you have to interact with it. But sometimes you do hand over hand. And, I think that's where a lot of that started was we're doing some hand over hand to get you there. Some people felt like it's kind of like the same effect on an Ouija board or something where you feel like something else is moving it, but most of the time it's really you. That's kind of what was happening. And there was actually a documentary that just came out at work. We talked about it in our book club. It's the Tell Them You Love Me. Very controversial documentary about a professor who basically had a very inappropriate relationship with an individual who was nonverbal and had the cognitive abilities of about a 6-month-old, but claimed that she could get him to type very lengthy sentences and whole college papers, but she was the only one who could do it. When family tried to do it, they could not get him to do it. And she essentially gaslit them. And she said, you just need to be trying harder. But when they investigated it, as part of the jury trial, they brought in some facilitators and individuals that were supposedly using facilitated communication very well. They showed the individual relying on it one picture, and then they stealthily changed it and showed a different picture to the facilitator, and it was always what the facilitator saw and not the kiddo. And I think there were just too many of those instances that were coming up when they were looking at facilitated communication that made most major groups say, this doesn't have scientific evidence. It's tricky, though, because when we are using that hand over hand, even I take a step back and I'm like, how much of this is me and how much of this is them? And so I have to be really mindful about that because I want to be increasing independence and not doing too much for them. And that's hard. And hand over hand also, we have lots of adults that are coming through now saying how aversive that is to them.
Well, and they get prompt dependent.
And they get prompt dependent too. And so you have to always be thinking, how am I going to, this is great that we can do this now, but what's the next step? What's the game plan? Because if we're prompt dependent on this forever, there's no independence. Yeah.
Gotcha.
I think the spellers, because that had come up in my feed quite a bit. I guess Facebook is hearing you or whatever, knowing you, and it came up. And I do think, I mean, I've heard of a couple people that like I follow that they're saying that their adult children have had success with it, but it feels I feel uneasy, like just a little bit because it just seems
Sounds a little strange. Honestly.
Yeah, I mean, I don't know.
It doesn't sound like very successful to me. Like,
Do you remember the iCarly? Was it iCarly?
Yeah,
That's a
iCarly.
Nickelodeon.
That's the
Carly
Carly.
Flashman.
Yeah.
Carly's voice or something along that line. So read that book.
Oh, I remember that.
Interesting.
Yes. Yeah. Because she typed, didn't she?
Yeah.
I think.
Yeah.
Computer. Yeah. No, and I think this probably
And would do it independently.
Yes.
Sometimes not.
Right.
And
Yeah.
And I think that's the key is can we move to, does the person ever move to independence in it? Because, to teach them how to type or to do the letterboard versus always having to support forever versus learning, is it a step?
right.
And what I say too, when I feel like it was born of good intentions, I mean, even I've had some individuals that have limited mobility, and so they'll put their elbow in the palm of my hand and they'll pivot, and that's just to hold your arm up.
For support.
But yes, for support. And I think that that's different than what they're talking about. Support, absolutely. We've got to provide supports where appropriate. And I think that was kind of the idea that a lot of these families had when they were trained to use it is that I am supporting, but I'm also occasionally hearing these words and then I'm getting my hopes up, and then my own feelings and my own emotions are kind of playing into what's coming out because of what I want to hear. And that's hard.
I think that there's a desperate place you go when you're a parent of a child that can't. I mean, I think about that many times. 23 years. I don't think I could live 23 years and not be able to tell anybody what I'm needing or feeling.
Right.
Like,
So,
I don't know
totally
how Zachary does it.
Yeah.
I mean, it's so I can see the. Yeah. I don't want to.
I think to clarify too, I think facilitated communication and the spellers, I think there's some differences there.
Mm-hmm.
So I don't know if they consider that, those that practice that and do that, just for our listeners, just so they know that we're not. You need to do your own research, because I don't know. It almost seems like I remember that there was a little bit of difference there where maybe they didn't say that it was a necessarily facilitated.
Gotcha.
And I'm not familiar enough with the spellers.
That's why I
haven't
just,
seen that.
I just hate to.
I know enough to be dangerous. Dawn,
Exactly,
Dawn
that's-
knows.
Yes, I know enough to be dangerous too. No, Chantel, and I never could pronounce her last name, French based. Her nonverbal son, adult son, somehow he had told them, I want a cell phone. And they asked him, why do you want a cell phone? You don't talk.
Oh, gosh.
I can text.
Yeah.
You know?
Chantel, Cicely, Kira.
Yeah.
CILA-KIRA.
The ARC brought her
I have heard
to
of,
town.
He's an artist. Her son's an artist.
Yeah.
I've heard of individuals that, even younger ones that have gotten a cell phone for texting and things like that.
Well, we were actually just talking about a kiddo today, another SLP, and he has a device and he has access to all these pictures that have all these messages, and he's very little, 3 or 4, but he's hyperlexic. So he prefers to just type it out because he loves his letters, but it's also functional. So he types it out and he does it without support.
I think
There's like apraxia too. I mean, so it's not just autism
that's true.
that causes speech
Oh,
delays or differences.
Absolutely. And then apraxia, like the individual you're referring to that can text, they prefer to type. It's faster sometimes. And sometimes it is because the way it takes a little while to get your icons organized exactly where you want them sometimes. And that's the other thing that can also either get you typing or get you talking, is that I want this thing right now. I can't find the thing right now. So I'm going to break down that wall. I'm going to type it, or I'm just going to say it. And that's where we sometimes get more verbalizations, is we're so frustrated by this stinking device that's not doing what it's supposed to do fast enough.
Oh, that's beautiful.
So I think I'd love to have your opinion on, so from the profound autism side of things, I'm going to just read you something.
Okay.
So this is a question. Society often equates a person's ability to verbally communicate with their level of intelligence. Can you discuss why this is a harmful belief to hold? Because this goes deep. For, like, you're talking about a soapbox, I would die on this hill. The concept of I do hear a lot of people saying, like, for instance, Zachary likes Barney. That does not mean that he has the mind of a 3-year-old.
Well, I told you yesterday, I said I am 34 and I have a master's degree and I still like the Cookie Monster.
Yeah. Who doesn't?
Who doesn't? Exactly.
Yeah.
Exactly. I encourage everybody to read a book by Mickey Rowe, and it is called Fearlessly Different, an autistic actor's journey to Broadway's biggest stage. And he is not profoundly autistic, but I think it's important. He has a really important message, and he talks a lot about, don't infantilize me, nothing about us without us. He ran into a lot of barriers in his book to Broadway. He just wasn't given roles. Nobody took him seriously. And it's because they had these preconceived notions about his intelligence because of how he presented. And he's not the only one. There are a lot of adults with autism that maybe were not verbal when they were younger, but they did acquire spoken language as they got older, and they're coming forward and they're talking about all the people they remember that infantilized them and made snap judgments about their intelligence that were not accurate. And so, anybody that has that thought, I usually think about it like this: how do I want to be perceived by this person in 20 years? So even if I see them right now and they are presenting with profound autism, if they got spoken language in 20 years, how are they going to remember me? Are they going to remember me as somebody that was their advocate and their champion and thought that they could do more than what they were showing? Or are they going to remember me as the person who gave up on them because they didn't think they were intelligent enough to be able to make gains? And so I always encourage everybody to kind of take a step back and think about that. Because, we do.
It's good advice.
Our individuals, they develop at different rates. We have our milestones and things, but not everybody follows that. And so you don't necessarily know what things are going to look like. And, my brother, he does not speak. And there's a lot of things that aren't really of interest to him. And we don't always have connections, but there's things that he does really, really well. And I don't want to discount that either, just because there's, these one or two things that he does really, really well that are really important to him, because if I'm just thinking in terms of intelligence, I fail to see those things that are so meaningful and so wonderful about him.
Right.
Because I just see everything else as this big negative, and I don't want that for anybody.
Gosh, Nathan.
Agreed.
Very good.
Isn't he good?
Yeah.
Yes.
Isn't he awesome?
So good.
He's very good. Yes. Very
Yeah,
good.
we got
And
lucky.
I also appreciate that you're research based. I love that you're
Yes.
talking about research and this is based on research, because when our kids were all first diagnosed like 20 years ago, we just held on to anything, and there was
Correct.
so much time that we probably wasted. And I love the idea of being evidence-based and research-based, and I just really appreciate that.
I do too. Yeah.
Not that saying that there's not going to be new research, in the
It's always
future.
changing.
It's always changing.
It's always
and I think that's
changing.
so cool. So,
Yeah. Thanks
Yeah.
for what you do. My gosh,
Yeah.
you're very lucky. He's a great SLP. Gosh.
Thanks for having me.
Yeah. I should keep thinking of all these questions for you.
I
but
know.
yeah, I could
We need
talk
to have you
forever.
back.
Yeah, we'll have you back. But we appreciate you being here. Heather, did you have any more questions or want to wrap anything up? Or Don has. Sorry, Don.
Don.
Yes, Don.
Well, I was excited to know that you were going to be here to get some free advice. My son is 27. He's verbal. I have, I've told on this podcast, I sat in on a job interview that he had. Oh my word. It was just awful. And I knew things were speech language that it was a deficit. Because I think that's his biggest autistic trait. So this job interview, you ask a question. I won't go through the misery of it, but
He takes a long time to process.
yes, he takes a long time. We have problems with tone of voice, just some others. So do you have any advice for me on how I can work?
It doesn't
Yeah.
get SLP for that.
Right.
Well, SLPs can help with that. Reasonable accommodations, oftentimes in job interviews. Not everyone will do it, but you can often get questions ahead of time. But also even just kind of thinking through what some common job interview questions are. And
Or just in general, Nathan, because I've worked with JR and I've taken him home. And if I'm talking to him like in the car, if I ask him a question, it takes him a very long time to answer. And I can see he's deciding, am I really going to answer this? Or, maybe I'm just not. And I can see that. And so I've said, JR, you need to answer me. It's good manners. I've asked you a question. You're my friend. So I'm wondering if that is anything you cover, not just job interview, although that skill's very.
yes, even for individuals that have verbal skills, we still recommend AAC sometimes, however that may look, because again, that difficulty with verbal interactions. And in the job interview, we've had individuals that go in and they have pre-generated responses to some of them that they've thought through. And they push a button, and it takes the processing time out of it, and that constraint, and because you're getting anxious, you're getting into survival mode, and then your executive functioning is
Isn't
going
that
right
the
down.
wall that you're talking
That's
about?
the wall
Maybe
of
JR,
awful that's
that's the
going
wall.
on.
Wall of awful.
Yeah.
Yeah.
Yep, it's the
Yeah.
wall of awful.
Eric has that too.
Because everyone gets nervous in an interview. I mean,
yeah.
I get nervous in an interview, and
And their skills are just not as.
yeah, if it would take me a while to process, I would think. So we're saying that JR could maybe benefit from.
Correct.
Yeah, I love it.
That'd be great.
Hey,
Well,
Don.
it's going on is it ISP plan, whatever, and we got on the waiting list at Missouri State, has a speech language hearing clinic. And so that's another place many times that you can get, I don't mean cheap.
I think it's like $25 an hour.
It was 25. It was
And
20.
they see adults.
They see students.
Student.
Oh, okay.
Student adults.
Gotcha.
Yeah.
I don't know if they see adults, actually. I don't know, but.
So they
Is that
did,
right?
they did an
It's
intake.
been a long time since my daughter's been
They
there.
have student clinicians, but they work across the lifespan. So they have little kiddos that they see, older adults.
Gotcha.
So they did an intake on JR because I got motivated after sitting in on that very awful job interview. And so we got him on the waiting list and he was called and interviewed. But by this time he did have a job. And so then it was a matter of timing, trying to get him in to see. But anyway, universities are often a good place to search for speech.
Yes, that's
and
very true.
at Missouri State, it's a graduate student. So you're not working with a licensed SLP, but supervised. So.
And universities often, I don't know what they have available now, I've been out so long, but they do oftentimes have groups to practice some of those skills amongst their peers too, and that can be really helpful.
Oh, good, good.
Awesome.
Well, you've been a wealth of information, Nathan.
Thank you.
Thank
Thank
you
you
so,
for
so
being
much
here.
for
Thank you so
being here.
much.
You did an excellent job. And
We're going to keep coming until you kick us out, by the way.
on in.
I'll be really depressed when we don't get to see you
we
anymore.
might all show up to Zachary's speech and language
I know.
session.
Is there like a two-way mirror where we can just watch?
There is in a couple of rooms.
Is there?
Yeah.
Are there cocktails? just kidding.
It's okay. We'll bring our own.
We'll go offside. It's fine.
Thank you so much.
Thank you for
Thanks,
having
Nathan.
me.
All right, Tara, where can everybody find us?
Okay.
Are you ready?
Yep, I am. I wrote it down this time. Hey, you can listen to us on Apple and Spotify. You just search for Navigating Adult Autism. And you can follow us on Facebook and Instagram. And you can also contact us through our email at moms@navigatingadultautism.com.
Okay, great. Thank you.
Thank you.
Yeah,
Bye-bye.
thanks.
Thanks,
Bye.
Nathan. Bye.